Welcome to New Mexico Now. My name is Dan Gutierrez, and today, clinical trials are an essential component of healthcare. They help ensure that the U.S. Food and Drug Administration approved products and treatments we use are safe and effective, and they offer hope for cures to debilitating diseases. Yet, a lack of diversity in clinical trials is a serious issue with significant health implications. So why is it essential for people of all backgrounds to participate in clinical trials? Well, today, we have Dr. Randall Morgan, a health disparities expert, and Ramona Burris, who is focused on assuring clinical research diversity, who will let us know. So, welcome to the show, you two.
Thank you, Dan.
Thank you. Pleasure to be here.
So why is it so important to have diversity in clinical trials?
Well, thank you for that question, Dan. A clinical trial is really a research study, and it answers specific research questions related to new medications. It can also help us to learn more about health conditions. And so in order for us to learn as much as possible about these medications, we must make sure that the trials reflect the people who live with that particular disease and for whom that medication will benefit. Many groups are not included in important medical research for a myriad of reasons, and it's imperative that we do a better job of inclusivity with our clinical trials. Some conditions such as diabetes and hypertension are most prevalent in those communities or those groups who are not involved in clinical trials. So therefore, we are working to do a much more focused recruitment effort with regard to diversity in clinical trials.
So can you tell us a little bit more about how a clinical trial even works?
Well, a clinical trial is a process, and it's a process that consists of 4 phases. And essentially, the key to the clinical trial is that the participants in the trial are informed about their participation, and they are informed about the trial and what that trial is going to hope to gain or to provide for us at its conclusion. But a successful clinical trial consists of 4 phases, one being a smaller study group of that particular medication, making sure that it is processed safely by the body. And once that phase is completed, other phases increase the number of participants and also at the end give the opportunity to study that medication compared to other medications that are already available.
So what would you say to somebody that is hesitant to join a clinical trial?
I would say that there is enough information for them to learn about the clinical trial, to be educated about the clinical trial, so that they can make an informed decision. I would not at all try to twist their arm, but I think that in providing information and also providing the opportunity for them to participate in the clinical trial for their own benefit or for the benefit of their community or family will often convince those who are hesitant to go forward and participate in clinical trials.
All right, Ramona, this one's for you. What is being done to improve the diversity in clinical trials?
Yeah, so first off, Dan, I want you, but then I also ask your audience to visit our website, researchincludesme.com. It's Janssen's opportunity to share information, to Dr. Morgan's point, about the clinical trial processes. So all are informed about the phases of clinical trials, but also that patient safety and participant safety is number one. But I think that's a critical first step. But outside of that, Janssen is wholeheartedly living into our commitment to make sure that our clinical trials are reflective of all patients of that particular health condition or disease state that we're looking at medication to treat or cure or prevent. So that's definitely important.
So tell us about the Research Includes Me program and what resources are there available?
Yeah, so it's a great website, chock full of information, again, to explain the process, but also it's an opportunity for those who are interested and research to be able to find some local opportunities for the different health conditions or disease states that they may be afflicted with. But more importantly, that's why the term research includes me. We want to empower. We want to empower the community, the patients, the caregivers to start the conversations with their physicians, with their healthcare providers, to explore what are the best opportunities for them specific to research.
All right, hit me one more time with that website. Where can we go for more information?
Yes, research includes me. That means all of us.com.
Sounds great, you too. Hey, thank you guys for hanging out with me this morning and letting us know about why we need diversity in our clinical trials so we can help more people out there.
You're more than welcome. Thank you.
Thank you, guys.